It's Monday, September 21. This is the news on PBCJ. I'm Simone Absalom. In our first story, we get an update on the COVID-19 pandemic currently affecting the island. Melvin Pennant has the latest update from the Ministry of Health and Wellness.
As at Monday morning, Jamaica's COVID-19 death toll stands at 70. On Sunday, another 3 deaths related to the novel coronavirus, COVID-19, were reported, as 155 more people tested positive for the virus. According to the Ministry of Health and Wellness, the latest mortalities are a 69-year-old male of a St. Catherine address, a 56-year-old female of a Portland address who also had comorbidities, a 52-year-old female of a St. Ann address who also had comorbidities. The total case number is now 5,143. 57 recoveries were reported on Sunday, pushing that total to 1,407. The active number of cases is 3,583. It also disclosed that there are 29 moderately ill and 7 critically ill patients. A total of 124 persons infected with the virus are currently in hospital, while 11 persons are quarantined in a government facility, and 23,784 are quarantined at home. At this time, there are 469 imported cases and 263 cases of local transmission, while 732 are contacts of confirmed cases. 236 are associated with the St. Catherine Workplace Cluster, and 3,443 cases are under investigation. Melvin Pennant, PBCJ News.
A U.S. Air Force aircraft transported a large mobile field hospital from South Carolina on Saturday to support Jamaica's ongoing response to the COVID-19 pandemic. The Southcom-funded modular hospital, valued at $750,000, can house up to 70 patient beds. It's equipped to operate autonomously and includes a high-efficiency particulate air and ultraviolet light air scrubber system. It also has 2 diesel generators and 8 air conditioning units. Medical teams using the hospital can configure it to isolate patients and conduct surgery operations if needed. The field hospital will be set up and handed over to the Jamaican government to staff, equip, and operate. U.S. Ambassador to Jamaica Donald Tapia will officially hand over the field hospital on September 24 during a ceremony at the National Chest Hospital in Kingston. In addition to the field hospital, Southcom has also funded the donation of handheld thermometers and patient beds at a cost of approximately $86,000. The community transmission phase of COVID-19 outbreak has forced the Health and Wellness Ministry to adjust its protocols to reflect that reality. With the country being cautioned to function and live with COVID-19, one of the most vulnerable places to rapid spread for the virus remains the workplace. Speaking at a recent virtual press brief, Chief Medical Officer Dr. Jacqueline Bessessa McKenzie says workers should treat each other as if they have the virus, with all attendant safety precautions.
Basic workplace rules are important for persons wherever it is that you work. And workers are required to wear a mask at work. And they must hand sanitize before entering their work area. Physical distancing, whether you're in an office, whether you're on a factory floor, whatever work it is that you do, physical distancing must be maintained at all work areas. Hand sanitization as you move from one work area to the next is important. It's physical distancing when you move to another location, when you go to have lunch. These are important things. Surfaces must be cleaned after use, and especially in areas where there are frequently used surfaces, these must be cleaned regularly. In this way, you can even have somebody that is positive, who don't know that they're positive, working alongside you, but they are not transmitting infection to you, they are not exposing you because they are protecting themselves, and you protect yourself as well to decrease that risk of transmission.
The CMO also spoke to the importance of management teams in the workplace and how to treat situations where infections are confirmed.
It is very important that management teams are engaged, fully engaged in knowing what it is that they have to do to inform their workers. Management must play an important part in advising workers about COVID-19. Workers are to be advised that if they develop a fever or they're not feeling well, then they should call in and stay home. Workplaces must make those allowances to prevent the possibility of somebody who is symptomatic coming to work. If persons are not feeling better after a few days at home, then they should seek medical advice, and that may include doing a test. If they have done a test and the test is positive, they will be required to stay at home for a minimum of 14 days, including 3 symptom-free days after symptoms are resolved. Now, because whatever workplace they're coming from has been observing all the workplace protocols, and that person would have been in a mask at work, would have been hand sanitizing as they move from area to area, then there is no need to close your business or to send home other workers.
In 2018, the World Bank helped to set up the Global Preparedness Monitoring Board, a body set up to monitor the world's readiness to respond to outbreaks and other health emergencies. Last Friday, in a joint meeting with the World Health Organization, the board, in a report, said that the world was unprepared for the current COVID-19 pandemic. The WHO Director General says nations should learn from this experience and invest in proactive and not reactive policies.
There has been a recurring pattern of money being thrown at outbreaks when they're already in full flow, but then funds no longer being available to prevent the next outbreak. Reviews and reports are only as good as the recommendations that are implemented. COVID-19 has shown that collectively the world was woefully underprepared. But with humility and togetherness, we can plan for the long term and invest in health and preparedness. This isn't charity. It's an investment in our collective future.
To date, there are over 31 million cases of the virus and over 969,000 deaths. And yet, in the past few weeks, there has been a reported plateauing of COVID-19 cases across the globe. However, according to Dr. Michael Ryan of the WHO, the momentum of the virus is still too high.
So we're adding about 1.8 to 2 million cases per week to the global case count, and an average somewhere between 40 and 50,000 deaths. And thankfully, that is not rising exponentially, but that is a hugely high figure to be settling at. That is not where we want to be. It's not where the Northern Hemisphere wants to be going into the winter season. It's not where developing countries want to be with their health services under 9 months of pressure. Nobody wants to be in this situation because the energy has not gone out of this pandemic. There's a lot of energy left in this spring, and this can drive the pandemic forward. The force of infection within our communities, and particularly in some countries, is still very high. And even though those numbers are flat at a global level, that covers up the fact that at a regional, sub-regional, or in specific countries, we're seeing significant rises in cases, as we're seeing in Europe. When we look at the number of human beings who've been exposed, this pandemic has a long way to burn in our society. It is not burnt out, it is not burning out, it is not going away, and especially for those countries entering their winter season, in terms of people coming together more indoors, there is a lot of work to do.
Head of the Hugh Lawson Sherrill Labour Institute, Danny Roberts, says employers, both in the public and private sector, should begin to look towards developing a comprehensive policy for working from home. He says these arrangements should be agreed upon by the employee, the employer, and trade unions. The need is even greater given the current COVID-19 pandemic being experienced worldwide. With the advent of the COVID-19 pandemic, employers have to find creative means to infuse flexible work arrangements, including working from home. Workers have an obligation to maintain productivity, and employers must clearly state the move forward.
In agreeing jointly between the employers and the employees about a work from home policy, there are some other issues which arise. For example, data protection and security is a crucial issue that employers would want to ensure that takes place, and therefore they would put whatever necessary precaution in place to make sure that the confidentiality of information relating to clients, etc., is not compromised by working from home. But it's also important to ensure that the home situation is equipped to be able to accommodate work from home.
With a work from home arrangement, the Labour Scholar says employers should consider a visit to the proposed working area, equipment supply, and utility cost. Mr. Roberts says as of now, there are no laws to treat with these issues.
What we would, however, expect is that from the standpoint of providing a protection for both employers and employees, the law could and should look at things like ensuring that workers who work from home are no less favorably treated in terms of promotional advancement, in terms of job security, and all the other arrangements which are now applicable to persons who work from the office.
There's also concern for workers who have to go into quarantine.
There is now, I believe, the need for some kind of a special dispensation to be included in the formulation of a policy, and perhaps it could even find itself in legislation to deal with workers who may have to be at home, the quarantine for 14 days, and how do you treat that as part of their sick leave arrangement? The existing provisions under the law would mean that they would either have to utilize their sick leave or their vacation leave, and in the absence of that, they would be on sick leave without pay. I think that having regard to the exigencies of the circumstances and the conditions brought about by COVID, and a kind of a force majeure situation, that I think consideration ought to be given to that by the government to develop some kind of a policy as it relates to treating with situations of that nature, because it certainly is burdensome. I mean, certainly in small enterprises, this is burdensome to have to pay the employee for 2 weeks to stay home, but equally, it is burdensome on the employee who may have to find the money to do the testing and to be at home for 2 weeks without pay.
With these concerns in mind, Mr. Robert adds that it's necessary to do a closer study of the implications of working from home to include an analysis of sectors and jobs which are most suitable for that scenario. New Jamaica Hotel and Tourist Association President JHTA Clifton Reeder is proposing that the organization acts as COVID-19 ambassadors in local communities. He says the move could be done in partnership with the Ministry of Health and Wellness. Managing Director of Moon Palace Jamaica, Clifton Reeder, made the proposal after being selected unopposed as the new head of the JHTA during its 59th annual general meeting at the Jamaica Pegasus Hotel in Kingston. He takes over from Omar Robinson, who served as president for 4 years. Minister of Tourism Edmund Bartlett says his team projects a 40% increase in arrivals when compared to the period preceding the massive downturn in the global industry due to the COVID-19 pandemic. He says approximately 30% of employees have returned to work, and some hotels have had encouraging numbers in bookings. Here's more in this report. Addressing the JHTA general meeting on Friday, Minister Bartlett said that the public health crisis has derailed preliminary end-of-year growth projections for the sector. He notes that at the end of February 2020, the country had recorded 5.5% increase in tourist arrivals over the same period in 2019. At that time, the country welcomed 1.2 million visitors,
with $859 million in revenues generated. He says if that trend holds for the rest of the year, the estimated end-of-year earnings will be $4 billion with 4.4 million visitors. The tourism minister says he's assessing the tourism projection with cautious optimism, with just about 30% of employees having returned to work, albeit under conditions of reduced hours and salaries. He says if the tourism sector can maintain current levels of interest, there's a potential for over 1 million visitors by year end, which would be a fairly impressive achievement, all things being considered.
More than 60,000 students will soon be able to see their Caribbean Secondary Education Certificate and Caribbean Advanced Proficiency Exam (CAPE) results. The Caribbean Examination Council will host a press conference Tuesday to officially release the results. 58,720 students were registered to sit the CSEC examinations and 16,184 to sit the CAPE. Regional students sat the exam in June due to the COVID-19 pandemic. Filing for citizenship in the United States could become even more challenging for some Jamaicans. This as the U.S. government has proposed steep increases in the fees for these services. Effective October 2, green card application fees will move to $2,750. Change of status will cost just under $1,000, while naturalization will cost $1,170. The administration is proposing that the green card fee be increased by $990. Naturalization costs will rise by $445. Immigration advocates say the new fee structure could prove burdensome to immigrants who need to access these services. In January of 2019, the government of Jamaica implemented a ban on single-use plastic straws, bags, and styrofoam. This was all in a bid to reduce the adverse impact of plastics on the environment. The ban is supported by a number of other initiatives, all with the express purpose to curb plastic pollution on the island. With the ban in place, some environmentalists are promoting the use of bamboo. Marlon Samuels tells us why.
It looks like a tree stretching into the air, but it's actually a grass, and it can grow by 1 meter or 3 feet in 24 hours. We're talking about bamboo. Across the world, there are over 1,000 different species of bamboo. The largest species found in Jamaica is the Bambusa vulgaris. There's an estimated 65,000 hectares of bamboo in Jamaica. Bamboo is regarded as a miracle plant that comes with a wide variety of uses. China has been using bamboo paper to write on since the Han Dynasty, which was some 200 years before Christ. It's also used medicinally because of its antibacterial properties. Bamboo shoots or sprouts can be eaten. It's high in fiber, proteins, vitamins, and minerals. You can order a range of dishes made from bamboo, including salads, soups, and stir-fry dishes. One can also sip on a cold beer from this grass. The diverse use of bamboo is almost never-ending. Recently, we are seeing bamboo transformed into fabrics. Some say it's as soft as silk. Bamboo is used globally as a building material. This is owing to its compressive strength, which some say is even stronger than concrete. In fact, its strength makes it a perfect replacement for tensile steel when reinforcing concrete. Aside from being durable and eco-friendly, bamboo as a construction material is inexpensive. Here in Jamaica, bamboo is also used as an alternative construction material. It is used to create beautiful floorings, accessories such as rugs, and wicker furniture, which is quite popular. The plastic ban has been a blessing in disguise, forcing local manufacturers to seek out eco-friendly alternative materials. One such Jamaican company is the Little Bamboo Hut. They transform the versatile bamboo plant into straws, utensils, plates, and pens. Tourism remains one of the mainstays of Jamaica's economy. Again, bamboo adds to the island's GDP with its myriad of uses in this vital industry. When you see menta bands welcome visitors to our shores, the last thought on your mind would be of bamboo. But guess what? Some of the musical instruments being used by these band members are made from bamboo. The rafts that carry visitors down the beautiful Rio Grande River are made of bamboo. Jamaica has been taking steps to expand its bamboo industry, to tap into the lucrative global market for bamboo products, which is estimated at US $10 billion. The island is also using it for construction of low-cost houses, which are also producing value-added products such as furniture and charcoal. Not only is it being used in Jamaica as an alternative to traditional charcoal, it is now being exported. In fact, Jamaica is the first country in the world to export bamboo charcoal to the United States. From here, the sky's the limit to what the bamboo plant can be used to do. With its high adaptability, one can never know where the bamboo production will lead us next. What is certain, however, that any bridge that the island can now build to economic prosperity will more likely be made from bamboo. For the news on PBCJ, I'm Marlon Samuels.
Time now to join Gabriel Thompson for a look at the local stock indices and other market movements. We go to the business report.
In Friday's trading session, the JSE Combined Index advanced by 2,281 points to close at under 400,000 units. Overall market activity resulted from trading in 75 stocks, of which 34 advanced, 32 declined, and 9 traded firm. The Junior Market Index declined by 11 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, Access Financial Services, and Blue Power Group Limited. Stocks declined for AMG Packaging and Paper Company, Barita Investments Limited, and Cargo Handlers Limited. Trading firm were Dolphin Cove Limited, Equity Line Mortgage Preference Shares, and Jetcon Corporation Limited. Kingston Wharves Limited was the volume leader with just over 4 million units, followed by Pulse Investments Limited with 2.5 million units and Lumber Dipper Limited with 2.4 million units. Now for the foreign exchange, the US dollar on Friday, September 18 ended trading at $142.75. The Canadian dollar sold for an average $108.46. The pound sterling traded for $184.60, and the euro ended trading at $170.07. Oil prices fell on Monday, weakened by the possible return of Libyan production and as rising coronavirus cases stoked worries about global demand, although the market drew support as a tropical storm threatened to disrupt output in the U.S. Gulf of Mexico. Brent crude futures fell 78 cents to $42.37 a barrel. West Texas Intermediate crude futures gained 84 cents to $40.27 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
In regional news, more men in Trinidad and Tobago are dying as a result of COVID-19. Technical advisor of hospital services in the office of the Chief Medical Officer, Dr. Anthony Parkinson, says the male-to-female ratio stands at 5-1. More in this report from Crystal Wilson.
There is a pattern as it relates to comorbidities and COVID-19 deaths, so says Technical Advisor of Hospital Services in the Office of the Chief Medical Officer, Dr. Anthony Parkinson. Dr. Parkinson updated on this country's COVID-19 ICU management during Saturday's Ministry of Health COVID-19 press briefing. According to Dr. Parkinson, hypertension and diabetes appears to be the most common among the underlying illnesses which affect COVID-19 patients who succumb to the virus. He said following those two are chronic diseases.
Followed closely by chronic kidney disease. People who have kidney disease, some are on dialysis, some just have bad kidneys that are borderline. They can live with it, but when you get the disease, when you get the COVID virus, you, as it were, being pushed over the edge.
Dr. Parkinson added that persons who are obese, who have a high history of cancer and cardiac issues, are also at higher risk if infected with COVID-19. He said, however, those most likely to succumb to the virus are the elderly.
We have from 65 and over seems to be the increase in the number of, or shall I say, the chance of succumbing to COVID. The average age of males and females who succumb to COVID in the ICU is about 65% actually.
The technical advisor of hospital services also reminded that young people are still at risk of contracting the virus.
Young people, you are not immune to this disease. I know it's a small chance that you could die from it, but you are not immune. Do not play Russian roulette with this disease. We understand it's inconvenient, but please, wear your mask when you're in the presence of others. Cut down the congregation of people together. Let's reduce the chance of you getting this disease.
Crystal Wilson, TTT News.
The Bahamian tourism minister says the decision to implement a vacation-in-place policy came as a result of compromise between the Ministries of Tourism and Health. The minister says while the policy may not seem tourism-friendly, its implementation is necessary. Jasmine Brown has more.
We think that there is demand, but there are certain impediments in place that make it a little bit more difficult to come to this destination. So, for example, you have a health visa, you have to get a COVID-19 test, you have to quarantine, vacation in place for 14 days, and some people see that as an impediment to travel, but we understand why our health professionals, our public health professionals, are making those requirements. It's not as tourism friendly as it could be, but we understand why they are doing what they're doing. And we're constantly reviewing to see how we can keep the effects of those protocols in place, but in some instances ease them as much as possible.
Earlier this month, Aguilar introduced the idea of VIP during a virtual press conference during which he said the Ministry of Tourism chose to use the phrase as opposed to the word quarantine to describe what tourists will be required to do when they enter the country. The tourism minister says officials do realize the policy may not be all that appealing to visitors. He responded to a top Bahama official's claim that vacation in place is no different than quarantine.
We're working with our public health officials to see what is feasible. Graham Davis is probably right. If I'm thinking about traveling to a destination and I've got to, not allowed to move out of that place, it isn't particularly appealing to me. But certainly in the case of his hotel, there's a lot of things for people to do. So probably would be easier for a hotel of his size to open and for persons to be able to enjoy all of the facilities and amenities that such a large hotel has. I can understand the smaller hotels would find a problem with that. So we're trying to figure out how to work through this quarantining to make it a little bit more palatable to the traveling public and to the businesses that are in the tourism sector.
The Ministry of Tourism is eyeing October 15th for the full reopening of all hotels nationwide. Despite that date, a handful of hotels across the country have said they have no plans of opening anytime soon. In fact, Aguilar says large hotel operators have indicated to the government that they prefer to wait until the United States November 3rd elections are completed and possibly until the Thanksgiving holiday near the end of November to consider opening their doors.
A number of those large hotels indicated that they wanted to wait until after the American election, possibly open just before Thanksgiving, possibly before Christmas. And we said, okay, fine, that's fair enough. But we're going to go ahead and announce on October the 15th to get the ball rolling, to get people starting to think about it, get airlines in place. It takes a little bit of time to ramp up, so we decided to go with October the 15th as a day to get everybody to start thinking about it.
Still, Aguilar says there is evidence that travel to the Bahamas is in high demand. Reporting for our news, I'm Jasmine Brown.
In Barbados, there is a by-election pending for residents of St. George North following the retirement of a member of parliament. We hear more from Barbados today.
The people of St. George North will head to the polls in a by-election within 90 days, beginning October 1st. Prime Minister Mia Mottley made the announcement last night after confirming that the Barbados Labour Party's Member of Parliament for the constituency, Glenn Clark, will be demitting office on September 30th. Addressing the constituency's annual general meeting, the Prime Minister revealed that Clark, who has served the constituency for the past 26 years, will take up the post of High Commissioner to Canada, replacing recently appointed President of the Senate, Senator Reginald Farley.
I believe, Glenn, that you will continue to bring that approach that you have, that brings people together, people of different backgrounds, people of different perspectives, people of different ideologies. That's the genius of Glenn Arley Clark, that he has been able to let everyone come to work together in pursuit of a common mission, whatever that mission is. So that, my friends, Glenn's exit shall occasion a vacancy in the Parliament of this nation. And as I said, within 90 days, a by-election will have to be called. I have every confidence that when that by-election is called, that the Barbados Labour Party shall do its utmost best once again to enjoy the will of the people as the people's representative.
Meantime, Clark, who came to office in September 1994, thanked the people of St. George North for their unwavering support over the last 2 decades and urged them to continue supporting the party.
I believe that our party is strong. Our branch is strong. We have several persons, eminent persons, who want to represent St. George and are qualified. I will be there to help, to guide, and to assist as much as I can. As I said, I will never leave this constituency. I urge the people of St. George North and Barbados to pray for us and help us select the best replacement. But above all, let us elect the Barbados Labour Party in this constituency. The only body knows the hour and the date is the lady sitting next to me. But as Owen always said, beware, the Son of Man may come at any time.
In sports, we take to the pitch with cricket. West Indies women and England would go to head today in the first T20 fixture in 5-match series. All matches are to be played at the Derbyshire in Cara County ground with no spectator present to minimize the possible exposure to COVID-19. The world number 2 ranked England have the benefit of home advantage against the 6th ranked visitors. However, Windies women interim head coach Andre Coley believes a month without competitive cricket has leveled the playing field. The second match of the series is set for Wednesday, with others booked for September 26, 28 and September 30. And that's our package. Thanks so much for making it PBCJ. Remember, we are the People's Station. Stay safe.